I'm good. How are you? Good morning and welcome to the 9:30 call this Monday morning. We'll give folks a minute to join. If you're a Patriots fan, we're back, which is good news. Celtics are yeah, Don.
Okay.
Celtics are warming up, so you know we'll have lots to watch this winter. As folks are joining, we're so excited to have Christy with other co-hosts this morning.
Yes, I have more than one better half.
Great. Well, I'll turn things right over to you at 9:33 and we'll get started for today.
Awesome. Thanks. Well, let me share my slides with folks. All right, there we go. A little bit of pumpkin goodness. Thanks, everybody. So, as most of you know, I am Christy Moulin. I'm the director at the Center for Early Childhood at the Home for Little Wanderers. And today, I'm here with a colleague, Annika. Do you want to introduce yourself?
Yeah, thank you, Chrissy. Hi, everyone. My name is Annika McCabe. I am with the Home for Little Wanderers. I've been with them for 7 years, and I actually started out in their New York school-based programs before moving up to Massachusetts recently. And now I'm supporting Christy with the Warmline and also doing some school-based work up here in the northern part of the Boston area. So excited to be here. I've listened in on a few calls, so I'm excited to be on this side of things this morning. Thank you.
Great. Welcome.
Yes, when Annika jumped on board with my team, I said, you've got to start going to the 9:30 call so you understand who all the people are and what we're working on here in Massachusetts. So you guys have done
Right.
it exactly what I would have expected, helped her get her feet under her.
Right.
Um, and we were also going to be joined by Cynthia Davis, who is the mental health consultation and operations manager on our team. But she had to be in the field doing consultation work today. And so she is not here with us, but that's okay. She is another member of my leadership team that really helps with this side of things and comes with decades of experience in early ed. Some of you may know her. She used to be at Associated before it was nursery.
Oh, and
Um,
Sarah Montoya is sharing some love for Cynthia Davis in the chat from Nursery.
yes, yes, she and the mental health consultants are doing amazing work out there. Maybe one day we'll get them to pause long enough to come and be on the 9:30
Right.
call. I also heard that they did a really great workshop last week for the Vital Village
Oh,
conference. So some of you
great.
have seen them there. But I digress. Here's what we're here for. We're going to give you guys a brief overview of what we are calling the warm line. And then what we really want is to help to name it. So we want to help, we want help coming up with a name that early childhood folks will hear and connect with and want to use. But for a minute, let's just check in with a little jack-o'-lantern fun. So take a look there and throw in the chat, which jack-o'-lantern are you feeling this Monday of Halloween week? I myself am feeling very number 5 right now, I think. Amy, what are you feeling?
I mean, I'm stuck between like classic 1 and 7, really.
Yes.
I'm seeing a lot of sevens in the chat also. That one seems to be resonating with people. Some eights, a four.
Awesome.
What's eight? That one's nice.
Yeah. I
Okay.
When I am the one decorating the jack-o'-lantern, I always go for a number 1 kind of basic look. But I'm vibing number 5 today.
Linda Schumacher recently had dental work, so appreciate the number two jack-o'-lantern. That is,
It's a very inclusive set of choices,
it
right?
sure is.
All right. Thank you, everyone, for tuning in. And I will throw over to Annika to keep. Oh, no, I won't. I lied. I will keep going.
But
Um,
Chrissy, just a note. I think every time you come on the call, there's like a 2 minute grounding situation. And I just think it's such a good reminder, especially on a Monday morning,
yeah.
to kind of like call everyone to like be here, be present. So just want to acknowledge how simple it is, but how powerful it is.
Thank you, Amy. Yes, it's intentional and it also takes like constant work to remember to do.
Right,
Like even in my team meetings, sometimes I forget that I didn't do the thing that we all know we need to do because we get moving so fast.
right. Thanks.
Um, so I also wanted to keep on that train here and ask people this question of how do you feel when staff or colleagues come to you for support with personal and professional stressors? And I gave you a little diagram here. So across the bottom, that's the x-axis of your experience level. So lowest to highest on the right. And then the y-axis is how knowledgeable you feel. Again, lowest at the bottom, highest at the top. So if you're someone who feels both experienced and knowledgeable, you would be more like baby number three, who is there clearly got this thing down with what do I do with the bottle and feeling very comfortable and confident in the activity versus maybe more like baby number two, who's like, I know what this is, but doesn't have the experience to really get it where it's supposed to go. So again, throw in the chat a number. Tell us, how do you feel when staff or colleagues come to you looking for support? A good mix of different perspectives, which is awesome. So, the warm line is for everybody. And so we're really excited to be able to tell you guys more about what it is and how it might help with colleagues needing support with stressors. Kathleen, I really like that you added that caveat of how we are ourselves impacts how we can show up for others, which is such an important part of this work. Now I will throw it over to Annika to talk to us about what is.
Thank you. So I really appreciate you guys being active in the chat. I have another question for people as I go through this slide about what a warm line is. So I'm wondering, either by show of hands or in the chat, how many people have heard of a warm line before, or called one, or know somebody who's called one. So I'm curious about that as I go through this. So a warm line, for those of you who don't know, it is a phone line answered by trained, supervised, and experienced early childhood professionals who are there to listen and support. It is not a crisis hotline, so it's not something that will be monitored 24/7, but it's also not limited to just educators. So it's really for people who work with 0 to 5 in any capacity. It fills a gap for when a person is struggling and needs to talk to somebody, but is not necessarily in crisis. And there's no other real appropriate resource available. And that's from the American Psychiatric Association. And then it also helps to close gaps in care and improve access to needed information and community resources. So it fills a little bit of that space between I'm in full-blown crisis and I'm fine. So I'm just looking at some of them that are familiar with it. Alternative to child welfare hotlines. Okay, thank you. So why a warm line? What are some of the reasons why people use this type of service?
And And Annika, I'll monitor the chat, so don't feel like you have to do that too. And I'll
Thank you.
interject.
All right, awesome. So these are two quotes from people who work in the field and, who better than to advocate for why Warmline is necessary and helpful to people than those who are working in the field themselves. So, we talk about self-care and the need for boundaries and the prevention of burnout, but access to options for processing and unburdening, which are very key to that prevention of burnout, are often limited at best. So I'm picturing, you have a hard day and you just want to talk to somebody at the end of that. And sometimes your colleague isn't available and they're burnt out and your partner doesn't know what you're talking about because they don't work in the field. And you just need somebody to maybe debrief and, like if they just said, process with. Somebody else said that caring for children in early childhood is both rewarding and unrelenting. Sometimes the stress can make it hard to enjoy the job and show up as your best self. So once again, we're hoping that the Warmline can be something that helps people feel more sustainable, I guess. Thank you.
So we wanted to try something, and I believe in us as a 9:30 call community that we can do this waterfall word flow. So having heard, what we think of, what we're describing as a warm line, we want you guys' help to come up with a name, as I mentioned, that early educators will really resonate with. So when I get to number 5 on my list here, I would like everyone to type a word or a phrase that they think of when we just talked about warm line. But don't press enter. Just type it in the box and then pause. And when I say ready, set, go, we'll all hit enter at the same time and it'll waterfall down our comments section. So we're trying to get our juices flowing on what comes to mind when we think of this idea of a warm line, a place we can call, somebody that can support us that gets early childhood. So remember, type it, but don't hit enter. So what word or phrase does the warm line bring to mind for you? Give everybody a few seconds to think and to type. Get my chat open so that I can see the water. All right, and ready, set, go. Safety net, support, a lot of support. Safe, friend, relief, understanding. Awesome. And we also did a little bit of brainstorming ourselves. So we're going to share some of those names with you. Some of them we came up in conversation with folks. Some of them, I'm not going to lie, ChatGPT helped a little bit. I'm resisting AI, but trying to be in there with it. So these are, kind of basic early childhood support line, wonders and worries listening line, young child's caregiver call center, listening for littles gets a little more sassier, loving littles listeners, a little more, what's the word? Flowy? No, lyrical, caregiver care line, early childhood caregiver connection. And then we thought of some that would require like a little bit of a tagline. So the sunshine line, when you feel cloudy, call for a little light. Or time out because nurturers need nurturing. Or the calm down connection, a safe space to rest, to reset, reflect, and return. Or if you like a good acronym, ECALM, Early Childhood Assist Line for Massachusetts. And these are just 11 choices. So what we would really like is for folks to share in the chat what of these do you like? Do you not like? What else do you think would be a good name? Feel free to come off chat and talk through it with us. Um, what
I mean, I would definitely call into the sunshine line.
Right. That was the one that again, ChatGPT helped us with that one, but there's something about that one that made me happy too.
Well, people have a lot of thoughts.
And it feels,
Um,
I was thinking about it like, what am I going to say to my colleague? Or like, oh, like call the, what is going to roll off the tongue? Or, like, oh, have you tried the e-com, the something?
Right,
yeah, I really feel like we have this sort of choice between like something cute and clever versus something that's like you know exactly what it is because you're
right.
calling the early childhood support line.
Noticed that Kate Warren Barnes in the chat talked about not getting them confused with the other warm lines that are in Massachusetts, which I wholeheartedly agree with, because I know that there's other warm lines around peer support and recovery services and things like that. So I agree that we definitely want to make sure that this is something that speaks to early childhood and not necessarily something else. So sometimes caregiver care line, I think that can maybe be confused with I'm caring
Right.
for an elderly person or something like that.
Right. Or a parent. Yeah. Kim Davenport says I think the word educator caregiver needs to be if it's about the workforce. So that would be that's another clue.
Sarah, you'd prefer professional versus cute. I appreciate that.
I also was going to say that this is, as we say, it's open to everybody. We're definitely gearing it towards the workforce, but we're not necessarily turning away parents or caregivers of little ones who come across our resource and are calling. Um, if I'm correct in saying that, Christy.
Of course you are. Yeah. I think it's we're really excited to see who calls something like this, and how it gets used and what we can learn from folks who feel like using it and logging into it. So it's definitely the kind of thing where we're figuring it out as we go and with input from the community, with input from this group, with input from other groups across the state, just trying to figure out how it, we won't know till we try, and once we try, we'll know a lot of things that might shift and alter where we go. I see Danubia's question. What's the intersection between this line and the I'm assuming MH, mental health support line? Um, so great question. Thank you, Danubia. I think we see this as a place where if someone calls and what they really need is the Massachusetts Behavioral Health Support Line, that we will tell them about what else is out there that gets them what they really need. If what they really need is to refer for EEC's mental health consultation program, then we'll be able to direct them in that direction. If what they really need is suicide crisis line, then we will absolutely send them in the right direction. So the intersection with all of the existing resources is that we want to be able to hear people process through their stress and then say, it sounds like this might be a good resource for you or that. But we don't want to replace or duplicate any of the existing amazing resources that are across the state. We really have pulled this out of the experience that we have in this field of people needing someone to talk to. And after 30 or 45 minutes on the phone, that's that's enough. That's the gap that we're trying to fill. So we know that there are a lot of resources and a lot of options for folks, but year after year kind of feel this like there's just this this space where we don't quite have a resource to really hold people's stress around being professional caregivers of children or being familial caregivers of children. Um, it, Kate Warren Barnes, yes, it could feel like that. I think it's an interesting thought to like know what early ed employers offer EAPs and how can we make sure that folks who call us know about them. EAP being employee assistance plan or program, it's like a benefit some employers offer to brief mental health. I think the difference would be that we're while this call will be answered by folks with early childhood mental health experience and supervision and support, it won't be brief treatment in the traditional sense. So I'm also looking, Carolina, if something is too cutesy, it may discourage serious conversations, or conversations that may already have barriers for discussion. I appreciate that. We don't want to make light of what folks are experiencing when it is.
Right.
Right. Sorry, lost my train of thought because I was looking at the Childhood Connect suggestion. Early childhood care line.
And I'll send you the chat so you don't have to
I
worry about
know. That's
any
what
of it. No, I know.
I
It's interesting to
appreciate.
read.
I'm
Yeah. This place would help us FCC providers a lot, especially right now since we're in the middle of this crisis.
yeah, absolutely. So if you're willing, Gianni, I apologize if I didn't pronounce your name correctly. Is there a name that really speaks to you as a family child care provider or a component of the name? You may have already typed it higher in the chat, but oh, great. Thanks, Gianni. Um, we definitely want this to be something that family child care providers feel is for them too. Um, Amaris, I would say it is both. It is primarily a space to be heard, and then secondarily, or maybe even on like the third level, a way for us to make sure people who need to be connected to other resources will get there. What we're not going to do is like case manage people. So I think there are resources for that. Edna, great question. Yes. So we have staff who speak English, Spanish, and we just hired someone new who speaks Mandarin, Chinese. Very excited about that capacity. And then we have a language line, so we would be able to use translation services. And I think if we find that we're using translation services for one particular language, that we would then try to recruit to hire a person to have the capacity. But there's no way other than language line to be able to really meet people in the moment without knowing what language they might need. Um,
There's
Kat,
a suggestion for Portuguese as well, and a volunteer for helping with Portuguese.
awesome. Um, yes, I think Portuguese we know is sort of the next high or maybe even higher need language, and especially in the family child care community. Um,
Kate Warren Bars wonder if there'll be any data collection on the volume of calls, resources, and requests.
of course, Kate Warren Barnes asked that. Absolutely. That is one of the really exciting parts about this. It's one of Annika's primary focuses is to really look at all the data coming in and then to share that data back with the community. So in um, aggregate form, really understanding what the callers are telling us and making sure that people in the field, advocates, policymakers, educators, program directors are all hearing what we're learning.
And then I'm all information is good information. So the questions like if we're getting a lot of calls for crises, why is that? Are they not do they
Right.
not know where their crisis number is? Are we not doing a good job of defining what we are? If we're
Hmm.
getting a lot of calls for resources, what are those resources that they're looking for? And again, how can we connect them? So I'm really excited to kind of just see what we get and then like Christy share it back out with people and hopefully grow and um, be able to use that feedback and data to then be improve as a resource for what people really need.
Um, all right. So there may have been a few other questions in there that we didn't get to, but we definitely will be looking through the chat, and this is the beginning of a conversation. By no means is this your only chance to talk with us. And I also have here on our final slide a
Hooray.
QR code. So if folks want to snap that, give us feedback. Sorry. What that QR code does is takes you to a form that says, how do you want to be involved? And give us your name and email and we'll follow up. Also, our emails are there on the screen. So as always, open to folks reaching out and following up. We definitely see this as a project for this whole community, not just us.
And Chrissy will send me the slides and we will post them in our follow-up folder and then we will send Christy and Annika the chat. And thank you for adding your email addresses. That's great. And QR code. 9:30 callers, let's send some love and appreciation in the chat so we can we'll include that when we send to Christy and Annika. I also added kind of midway through the call, there's November 1st is a critical date in the government shutdown around SNAP. If you've been kind of paying attention in Massachusetts, the governor spoke on this last Friday. It's been in the news all weekend. There's a rally tomorrow at the State House. This is critical. The state has said they cannot fill the hole that would be created by the loss of SNAP benefits from the federal government. So I put in the chat, there's a rally Project Bread is organizing through its Make Hunger History Coalition. They're asking folks to RSVP if you want to attend the rally. But if you, we also know that there is Head Starts. There are 6 Head Starts in Massachusetts that have a November 1 start date. So we are continuing to monitor that situation, get accurate information, and we do have sharing the microphone on Wednesday here in the 9:30 call. So if you have an update, announcement, question, reflection, please join us then. Thank you to Chrissy and Annika. It was so great to start the week off with this call. And we will send you the chat and other folks, please, everybody, have a good day um, here on this last week of October.
Thanks, Amy. Thanks, everybody.
Bye. Thank
Thank
you.
you.
Thank you.